Perfect. Yeah, thank you all so much for having us here. We're very excited to join you and be able to share, some information about anxiety and mood disorders. So to give you, come on, slides. There we go. Okay. Just to give you a little brief background about myself and Alicia, my name is Brianna Bernardo. I'm a licensed clinical psychologist, and I'm also a certified school psychologist. And I am the REACH program director for Springfield Behavioral, and we'll share just in a minute a little bit more information about what the REACH program is and how we've partnered with North Penn School District.
Hey, everybody, my name is Alicia Herford. I'm also a licensed clinical psychologist, and I team up with Brianna as the REACH program assistant director.
So as we mentioned, our REACH program is here in the district, and we are an intensive school-based therapy program where we're seeking to offer more support to students who have different mental health needs. Some of our overall, we have several goals we're working on at all times, but kind of overall broad goals. We want to increase students' attendance and grades, get them more connected to their school, as well as work to decrease those mental health symptoms, make them feel more socially successful, make them feel better about their academics. And really, again, just feeling better overall in terms of their connections to others and also their feelings about themselves. And currently our program is in place at Penndale Middle School, the Northbridge School, and also at North Penn High School. So each of those schools has 2 mental health therapists that are doing groups and individual therapy sessions with the students. They're also working very closely with the administrative teams, the teachers, counselors, getting in touch with families, guardians, making sure that they understand what's going on with the students as well. The actual referral process, this is something where the school will identify who they feel, needs the student or needs the service, who would really benefit, be a good fit. That often comes through special education supervisors, again, by way of school counselors, possibly teachers, and certainly the building administrators. So at this current time, students and families don't self-refer into the program. But as Dr. Brocksterman said, any concerns that you have, I would encourage you as well to reach out to your school counselors, make sure that they know what's going on with your students. Because in addition to REACH, there's also many other levels and types of programs, that are available within the North Penn School District. And then in addition to the REACH program, there are also some ways that Springfield Behavioral seeks to support the community. While we have offices across 3 different states, Pennsylvania, New Jersey, and Delaware, right in your neighborhood, a little bit more close to home, we have offices here in King of Prussia. We also have offices in North Wales, and then we have a partnership with J. Snyder Therapeutic Services, which also has offices in Bluebell, again in North Wales and Ambler. So, even though we're offering, certainly the telehealth therapy where you could see any of our practitioners, we do have those in-person services available at those offices, except most major commercial insurances. And we're doing, family therapy, individual therapy, seeing clients of all ages, young all the way up through adults, grandparents. And then we also have medication services that we offer with psychiatrists and nurse practitioners.
So just taking a minute to go over our goals for today. In our PowerPoint, which we'll continue to share, we're going to be discussing some mental health trends that we're noticing in our work with children and teens, and also taking a look at the developmental differences between kids and teens and how mental health symptoms might present differently based on the kid's age and developmental level. Also looking at how warning signs of concerns can look different depending on age. And also the kind of bigger overall goal is exploring what's the difference between what we would consider typical development versus what might be more concerning in terms of a need to seek mental health treatment. We'll give you a brief overview of some common mental health disorders, as Dr. Brocksterman mentioned, focusing mostly on anxiety and mood disorders. Then the moderated discussion, as Whitney mentioned, and a little bit of time for Q&A at the end. So just want to give everybody a moment to read through this list of what we would call behavioral signs that could suggest that there is underlying mental health concern. You might notice that a lot of these behaviors are observable in nature, so they might be ones that might have consequences, let's say at school, at home, in the community. So maybe they're ones that are getting more attention first before some of the emotional or physical symptoms, perhaps, which we'll go over on the next slide. And again, a lot of these behaviors too can be a part of normal development, expected development, can be influenced by hormones, maybe kids wanting more independence, that kind of stuff. And so this list a little bit longer is some emotional or physical signs of potential underlying mental health concerns. Some of these might be observable, and some might not be as well. And I would say another thing that's important to remember about these, and this is something we'll be highlighting throughout the presentation, is to keep in mind, how often these things are occurring, how long they're occurring for, and how severe the presentation is. So that's something that we're kind of weaving into our talk today. Okay. So potential warning signs by developmental level. So when you're looking at kind of preschool age children, elementary age children, a lot of what you might see might be more behavioral in nature. Kids that age may not have the cognitive abilities or language development necessary to be expressing things in words as older kids might. So you might see it come out more behaviorally. These are also kind of the age ranges, particularly elementary school, where you might see ADHD onset, maybe separation anxiety, generalized anxiety, some of those types of concerns. And then middle school, high school age, again, some of the warning signs can also kind of tricky here, be signs of normal development. So we want to help you guys to kind of parse that out. So some, experimentation with substance use, with one's sexuality, that kind of stuff can be a very normal developmental feature that can also be a warning sign. So again, we'll help you guys to parse that out.
So the list that we just shared, you can see there's a lot of stuff on there, right? And you might recognize a lot of those behaviors and say, well, that's my first grader, that's my seventh grader, that's definitely my high schooler. So when we see all these different warning signs that are out there, it's really difficult to understand, well, when should I be concerned? When do I sort of take these pieces and put them together into an overall picture that makes me really nervous for my child, for my teenager, and leaving me trying to figure out what else needs to happen here. Do they need more care? Is there something else that I should be doing? Versus when are they just moody? So we want to talk a little bit more about, again, is my child just stressed? Could it be something more? And how do I differentiate those things? So when we're thinking about just, the stress side of it, that's usually much more caused by that like situational external trigger, right? I'm stressed about this thing that is happening, that is coming up, that's kind of maybe overarching. I'm stressed about leaving for college soon, any of those kinds of things. It's tied to more of that external trigger. Could be short term, could be long term. Again, I could be stressed about an exam I have next Friday. I could be stressed about college, and that's kind of always lingering throughout the entire school year. Usually once the stressor has passed, we see that overall kind of physiological reaction, emotional reaction, thoughts about the stressful event, they start to decrease. The kid seems to be feeling better. Once that exam is done, whew, okay, relief, I'm feeling a lot better now. Again, getting to college, getting through some of these other things might take a little bit longer to see some of that stress go away. But we also see that the stress that the person's experiencing is really in proportion to the actual event, right? It's an exam, I'm feeling nervous, I might have a little bit of trouble sleeping the night before, but I'm not having a huge blow up reaction that again could indicate like my reaction is wildly different to the actual event that's pushing it to happen. Versus anxiety, that's when we're seeing again more of that persistence. We're seeing more of that excessive worry, and it's really difficult to control. This is a kiddo who's struggling to get a hold of their emotions and really, kind of manage what's happening on their day to day. And these are worries that usually don't go away when the stressor has passed. We often call it anxiety like whack-a-mole, right? As soon as you hit one thing, boom, another one pops up. So it's not enough to say to that kiddo, hey, your test passed, great job, you did so well, you worked so hard, whatever it might be. That's the yeah, but there's still another one next week. Yeah, but I still have so much homework. Yeah, but there's this other thing happening, where it just seems like they have a really hard time putting it behind them and feeling better, feeling that relief that we might see a little bit more on the stress side. Again, their reactions are out of proportion to the event that's precipitating it. The kid who has that test coming up, the anxious kid might be worrying about it, weeks before the test is actually going to happen rather than, maybe a couple of days before, maybe the morning of, depending on the kiddo. But overall, their reactions are making it very difficult for them to function on that day to day. I'm so consumed with this anxious worry that I can't focus in my other classes, or I seem like I'm not present at home. And that can really lead to a strong pattern of avoidance. To go in and do the thing is to cause that anxiety to spike. The moment I don't do the thing, I get some relief, right? My anxiety has decreased. It can be a really dangerous pattern that emerges of more and more avoidance. So when we're talking about when do I worry, as Alicia was sharing, we're thinking about that intensity and frequency. How intense is the reaction? How frequently am I seeing it? That's where we really want to kind of tune into of like, okay, should I be concerned about this? So when it's something more, looking at just kind of, again, a small grouping of anxiety disorders, we wanted to touch on just a couple of the ones that might be more commonly seen in children and adolescents. So one of the most common ones that we notice is this generalized anxiety disorder. And this one is particularly frustrating because, as it says, generalized. It's the whack-a-mole about everything. It's the what if worry, about many, many different things that are going to happen. It's not about that one particular, I'm stressed about the exam. I'm stressed about the exam and global warming and my friends and this and that and TV and whatever else. But it's that excessive anxiety and, again, worry that's difficult to control. And we talk about the frequency, it's occurring more days than not, right? This is not something that every once in a while they seem a little worried. This is something more often than not, they seem very worried, they seem very distressed. It's occurring for at least 6 months. Again, if I have something coming up, if I have an AP exam coming up, I might in February or March start getting nervous about that. My teachers are talking about it. But if it's lasting, that's where I might be like, maybe there's something happening here that's making it really difficult to manage through my anxiety. And all, this great graphic really lays out some of the different symptoms. Certainly, again, the excessive worry, the overthinking, the tension within their body. It may show up as irritability. They might be kind of feeling a little twitchy, like there's kind of a little bit too much adrenaline possibly going in their body. That again is really impeding those functions. This is a kid who I can go to a thing, but I'm not really there. I'm not really present and enjoying whatever's going on. I'm too busy being consumed with the worry that I'm feeling. Now, on the flip side of that, one of the flip sides of that, we can see social anxiety, which has more of that direct trigger, right? It's not as generalized. It could be about a number of different social situations, but it's this overall marked fear or anxiety, about this preoccupation of, am I going to be facing some kind of scrutiny? What are other people going to be thinking about me? And that worry about it. Again, we all feel that from time to time, right? We're all nervous. I'm a little nervous right now. What are people thinking as I'm presenting? But I'm able to come and I'm able to do this because I'm not experiencing the social anxiety that would make, one of the examples that we show here, it really difficult to present to other people, right? To present in front of a class. Some people, it shows up like eating in front of other people. Again, ordering food can be very stressful. But again, to the point where it's like, that's an intense anxiety. It's not just like, oh, I'm a little nervous calling to make this appointment. It's, I'm avoiding it because my heart is racing. My stomach is hurting. My hands are shaky. I'm feeling lightheaded. It's this really strong physiological reaction because your brain and your body are communicating and saying there's danger. We need to react as if we're being attacked by a wild animal. That's how it feels physically to the person's body when they're struggling with that social anxiety. And again, you'll see this, it's typically lasting more than 6 months. Kiddo going to a new school, for example, especially some of our elementary school kids, for example, they're going to feel nervous. Going to be new friends. How's this going to go? But, if it's persisting longer, well into the school year when you would really hope that they've adjusted, that's where it might be like, hey, there's still a lot of concerns happening. Maybe there's something more that this kiddo needs to feel supported. Similarly, with the separation anxiety, this is something where, again, we're looking at what's developmentally appropriate, size of the problem, size of the reaction, what we might expect to see with, maybe some of our kiddos under 5, under 6, we might think is not as typical, not as expected when that child gets to be 11, 12, 15, into those older ages where they're really struggling with separating from parents, caregivers, again, that extreme clinginess, that, I'm very withdrawn if I'm not around sort of my core care people. I have a lot of distress, again, beyond a little like, hey, I'm nervous to say bye, but eventually I'm able to go into my classroom, and adjust and go have a great day. Some kids are the kids that are just like, bye, and all you see is the back of their head as they run away. But these are definitely the kiddos who are really, really struggling, again, over that longer period of time, right? That frequency is it's occurring often and it's lasting longer. for at least 4 weeks. These are kiddos who might be really preoccupied with thoughts about getting lost, being kidnapped. What if something bad happens? So you can see that flavor of again, overall anxiety, but specifically attached to being separated from this person that they've identified. This is my caregiver. I feel the safest with them. So these are kids that might really struggle to, again, do some of what we would more normally expect from our children, going over to a friend's house, going on errands because they're worried, what if something happens to me? What if I'm not safe? Certainly going to school, I'm sure, again, a lot of our elementary school teachers might see this as a more expected part of their day, helping kiddos adjust in that way. But certainly as we get more into that middle school, high school, it's probably a little less expected. And again, can feel nervous, can feel, what's going to happen? Am I going to be okay? But it's that extreme distress, that extreme worry that we see with social anxiety that becomes more concerning. When we're looking at, panic disorder versus panic attacks, again, this can be a part of a lot of different anxiety presentations. Anxiety can get intense enough that it becomes that anxiety attack, turns into a panic attack. And we see, again, this surge of discomfort, this strong reaction, but it usually subsides within a matter of minutes. Again, your body is on full alert that there is danger, but it's something that our body is not meant to sustain over a long period of time. It's meant to be responsive to a direct threat, run away, fight the threat, whatever it is. And then go away. So, when we see the panic attacks that are lasting longer, occurring more frequently, that's where we're seeing it turn into more of a panic disorder. Where again, we're seeing those recurrent, unexpected panic attacks. Again, I'm still seeing that, surge and then going away after a few minutes, but it's persistent. Again, this frequency, right? It's an intensity and it's frequent, happening a lot more often. We don't like that. We don't like the unpredictability of a panic attack. When will it happen? So we start to try to make meaning of that. Well, it happened on a Thursday when I was in gym class. Oh, it happened, last time I went to my music class. Oh, it happened in art. And so our brain wants to say, hey, this happened in art. Art must be causing my panic attacks. I better not go to my art class anymore. I better avoid going to that particular shopping center. I better avoid going to that friend's house. Which really leads to more of those maladaptive changes because we're trying to prevent those attacks. Will it happen in art? I don't go, it won't happen. So it's a little bit of that magical thinking that can lead to, again, a lot of avoidance that in the short term feels really rewarding. Long term is not going to be a healthy, adaptive coping strategy. And again, difficulty distinguishing between these because both can really involve all these different symptoms. This is something that, as adults, we often present to the emergency room with, right? I think I'm having a heart attack. And sometimes people will say, oh, it's just panic, it's just anxiety, because it can feel like that shortness of breath, that chest pain, nausea, so it's something that, again, a very intense physical reaction that is hard to distinguish sometimes from other things that are going on. The more we see it moving from, hey, this is a one-time, two-time thing to more of that panic disorder. And yeah, can happen with a lot of different mental health, presentations and disorders. Okay, back to Alicia.
Make sure to unmute myself. Just as Brianna walked us through with anxiety disorders, a similar question here with more mood-related concerns. So how do I know when to be concerned? Is my kid sad or moody or being a typical teenager, preteen, or could it be something more? So again, sadness, moodiness. Sadness is a normal human emotion. We all experience it at some point in time. Tends to be triggered by a specific event. And as time passes, it tends to subside. And then moodiness as well can be caused by typical hormonal shifts in development. But when we would be concerned about it looking more like a mood disorder, would be this sadness not necessarily coming about because of a particular event. It could, but also it could not. And it's more likely to have a larger impact on all areas of your life and to last for longer. So let's take, for example, this could happen for a kid at any stage of development. A friendship ends, there was bad blood, it ended. So maybe a normal kind of like sadness reaction would be the kid's sad for a little while. Maybe they're more tearful. Maybe they're more irritable at home. Maybe they're a little bit worried about seeking out new friendships. But maybe we'd be more concerned if it was moving to a mood disorder, if they were having more persistent thoughts like, no one really likes me, no one wants to be my friend again. They start self-isolating, maybe they're tearful very often. So again, focusing on intensity of the symptoms, how long they're lasting, that kind of thing. So again, when it's something more, so going through a couple common mood disorders, by no means an exhaustive list, but some more that we would typically see in kids in school age and adolescents. Probably the most well-known of them all, major depressive disorder. So key points to note here with the list of symptoms that you see is that you're seeing either depressed or low mood and loss of interest in things that maybe the kid used to enjoy or found pleasure in, plus at least 4 of the below list. So it's a lot of different symptoms clustered together. They're happening most of the day and nearly every day. So that really speaks to that intensity and potential to impact a lot of important ways in which the kid might be functioning at school, at home, in the community, with friends. So again, appetite and sleep can be impacted in either way. Um, Usually loss of energy or fatigue can be a part of it as well. Challenges with concentration, moving more quickly than normal or more slowly than normal, could be guilt, feelings of worthlessness, and then the piece of suicidal ideation, intent, plan, and attempts. And these things existing together for at least 2 weeks. So that's what separates it from, your typical sadness. So persistent depressive disorder, in case anyone's familiar, used to be called dysthymia. And the reason there's a picture of Eeyore on here is I remember I had a professor in grad school who described this as like the Eeyore syndrome, which always helped me to remember, okay, how's this different from other things going on? So think of it as like a lower depressed mood, but for a very long period of time without any respite. So again, most of the day, more days than not, for kids, at least a year. And there's no period where they go without the symptoms for more than 2 months at any point in time. So it's very persistent in that way. In terms of the actual symptoms, as you can see in the list, a lot of overlap with the ones with a major depressive disorder episode as well. Okay, so disruptive mood dysregulation disorder. So this is something kids are diagnosed with between age 6 to 18. Symptoms might be there before age 10. And the reason that it's not diagnosed before age 6 is if you look at what some of the criteria are for this, temper outbursts, that could be verbal rage, or maybe physical aggression towards people, property. If you think about kids under age 6, that is more or less developmentally appropriate as they go through toddlerhood and that kind of thing. So we're looking at the 6 to 18 age range there. So again, severe recurrent temper outbursts could be verbal, could be physical, could be both. And then the child's mood in between those outbursts is irritable, kind of persistently. So just to give kind of an example, let's say your kid is frustrated in school. Let's say they do badly on a test that they get back and they throw down their textbook and like storm out of the classroom. Okay, that was in response to like identifiable stressor. They acted on it. But that's different than, let's say, like several times a week, a child is, verbally aggressive, maybe saying obscenities towards school staff, leaving the classroom, punching lockers, let's say, smashing things, who knows? So just the difference of kind of frequency and severity there. Okay, next one. And then last one to just touch on briefly, premenstrual dysphoric disorder. So I feel like a lot of people might be familiar with the term PMS. So when you think of PMDD, You can think there's a lot of overlap again with PMS, as you can see in this graphic here. There's a lot of overlap with symptoms. However, with PMDD, the severity is greater. So you can see where there's like the 3 red dots under certain symptoms. That's where you might see a more severe presentation with PMDD. And the most important thing as well with this is to look at, when are the symptoms beginning? When do they start to subside? And then are there points in time where they're absent? So they tend to appear the week before menstruating. When it begins, they tend to subside. And then at other times of the month, they're not really there. So that's a helpful way to tell.
I think this is an important one to not overlook. We have a lot of young people who are struggling with their mood, during this time. And, it can be very difficult to narrow that down, so sometimes having them track, kind of, when are you feeling this way? Like, let's try to notice that. And kind of as a parent or a caregiver, an educator, seeing if there's any pattern that you can detect as well, because it could be really important information for that person, to understand, like, how is my body, experiencing my menstrual cycle. So we overall wanted to, again, just kind of go through some brief, distinguishing between when am I worried, when am I not. There's some other information that we'll offer, throughout, kind of, again, moderated discussion, certainly through the Q&A as well. But we wanted to, I think, hand it back over to Whitney so that, she can lead some of our discussions as well. And Whitney, I don't know, since we have some slides to share during this, I don't know if you wanted us to kind of keep screen sharing or leave it up, sort of what your thoughts were about that.
Sure, yeah, if that's helpful to
Okay.
have the screen up already, we can certainly do that. So thank you so much for that lovely overview. It was very informative. And I think, to your point, and as you kept mentioning, the key part here is really understanding what sort of typical or what you might see versus when you might need to seek some support. So I do have some questions for you. And before I get started, I just want to remind folks, please use that Q&A box to ask any questions that you have. And we will address those questions during the audience Q&A following this panel discussion. Okay, so like I said, you shared all this wonderful information, and it was really thinking about it from kindergarten all the way up into 12th grade, right? So that's a really broad developmental range, which is really exciting to hear about. But I think sort of when our minds think about elementary school and mood symptoms, we tend to just automatically think about the older elementary grades, right? However, you can see some of these symptoms even with our younger elementary school students. So with that in mind, I'm wondering, what is helpful to know about mental health concerns in our early elementary children? And what are some of the behavioral or communication differences that we might see?
Yeah, I think it's really important to understand that at different stages, as we shared in the beginning of the presentation, kids will show their distress in different ways. Those younger kids, they'll feel those big feelings, but they will show them much more likely through their behaviors. This is, anxiety or depression is much more likely to show up as anger, frustration or aggression, with those younger kids, especially the, kindergartners, the first graders, third, fourth graders. The kids who are really coming into their verbal ability, that are really being able to, learning how to be able to connect, what am I feeling in my body? How do I connect that to thoughts, identified emotions, and then verbally share that with the adults around me? And then even of a further skill, identify what might help me. It's a lot to expect of a first grader. So certainly, again, they'll show those concerns through a lot of the behavior. It could be through their art, it could be through their creativity, their play with their friends. They may be acting out different, frustration, emotions, aggression with their friends. They may have big reactions to distress with their friends. Their little bodies, big emotions that they just don't know what to do with yet. I think it's also really important to understand with the younger kiddos that they will often use the same words that they hear adults using, older kids using, but they don't really understand the same way of what that means. They might understand, for example, that death is something serious, but they won't really understand, like, what does that mean? What do you mean that it's died, that someone has died? What do you mean that it's gone forever? So you might hear them say things like, well, I just want to die. I don't want to be alive anymore. Which is really scary to hear from your, again, kindergartner, first grader, second grader. Because again, we automatically go to this really, of course, very frightened place of, what's going on with my child in this moment. So I think that helping them to, really, again, talk about it more, trying to approach it with curiosity, and not trying to be too focused on a why. Oftentimes adults interacting with those younger kids, the why, like, why did you do that? Why do you feel this way? Why? And, again, as adults, it makes sense, right? We want a cause, we want an effect, we want to understand what's going on here. But with those younger kids, they really might struggle to give that to you. They might genuinely not know. I don't know what my why is. I just did the thing. Why did I hit my friend? I don't know, because I wanted to in the moment. It might not go any further than that initial impulsivity. So trying to kind of overly focus on the why versus getting that more just kind of curiosity of, I wonder what you were feeling in that moment. Seems like you were feeling angry, kind of helping them have those words. I hear you saying that you are feeling like you want to die. It makes me think you must be feeling really upset right now. You must be feeling really sad right now. You must be feeling really angry right now. Helping them to identify what's that emotion that I'm experiencing and helping them understand, it's okay to feel that emotion. It's what you do with it. It's okay to be angry. It's not okay to hit your friend. It's okay to be angry at your teacher. It's not okay to run out of the room. That's not safe. Obviously not in the height of that child's emotion. It's not the time to have that discussion. But certainly, helping them recognize what's happening in my body. How do I give words to it? By giving them those words to start off, and modeling for ourselves as adults, show your emotional work. When you're eating dinner, if you're around your kid, you're driving in the car, someone cuts you off. That's a great moment to model, wow, I'm so angry at that person, like they just cut me off. They just slammed on their brakes, whatever it is, like, I'm going to take some breaths to help myself calm down. You might think, well, my kid's not really paying attention to that, but they do notice, and they do pick up on those things. So I think that the more we can model it and understand that they're going to experience similar things and show it in different ways, the more we give them the skills to verbalize and get to those other levels of being able to say, this is what I'm feeling and this is what might help me. Yeah.
I love that. Really thinking about that guided support, right? So just as
Mm-hmm.
you were describing, because with their littles, it can be a little bit hard. And then especially modeling, like you said, is so helpful with helping our little sort of understand, their thoughts, their behaviors, and their emotions. So thank you so much for sharing that.
Yeah, absolutely.
Okay, so another question. How do you determine the level of care that a young person might require based on thoughts and behaviors that they are showing?
Brianna, would you be able to
Yeah.
bring up the perfect? Okay. So one way that might be helpful to look kind of at this question or answer it, would be viewing this kind of on a continuum. Think of a stoplight. Green means go, things are going well. Yellow, slow down, caution, and red, like stop, danger, let's reconsider. So in the green zone, your child might be having emotional reactions to something, but it feels in proportion to what the event is. It's related to that event. Maybe some examples are a relationship breakup, feeling left out by friends, not achieving something that they wanted in extracurriculars or at school, anxiety about an upcoming test, anything like that. So again, the intensity could be high after the event or leading up to it, depending on what type of feeling. But the duration and the frequency are shorter. As time passes, those feelings subside accordingly. So when your kids are in the green zone, still important to give them extra support and kind of added social support as well. If your child is maybe moving towards the yellow zone, there might be more functional impairments. And what we mean is that there are their mental health concerns are posing challenges to how they're doing at school or at home or with friends. So examples could be, again, like grades dropping, maybe they're skipping class, maybe they're refusing school, less interest in activities maybe they loved before, and a lack of interest in spending time, let's say with friends, with family. And so you're starting to notice these things happening more days than not. And I would say in this case, you might want to consider outpatient therapy, and possibly a medication evaluation, always up to individual preferences. But that's an option that can sometimes be helpful to explore. And then moving more towards the red section, you have behaviors that, again, are having pretty extreme consequences, let's say in school and the community, or risk related. So the top of that list, suicidal statements or behaviors, parasuicidal statements, maybe self-harming behaviors, truancy issues at school. Again, these things occurring pretty frequently with higher intensity, as we've been talking about. Oh.
Sorry.
And so if we're kind of at the red, there's a bunch of different considerations for ways to best support our kids. So you might have an intensive outpatient type program, which, to give people an idea in case you're not familiar with what that program entails, it's usually a couple times a week, typically like after school hours. The kids are in groups and they might do some individual work as well. Individual counseling. A partial hospitalization program is one kind of step up from that. So the kids are attending that more for a full day. They might be getting time there to do academic work, etc. So it's kind of like one step up. And then inpatient care is if safety concerns are strong enough, there's like immediate risk to the child. So you're potentially, calling mobile crisis, or you're visiting your nearest emergency room, that kind of thing. Yeah. So hopefully that helps to kind of help everyone to see there's a lot of different types of support we can provide our kids and what might be most appropriate depending on what you are seeing.
Oh my goodness, thank you. This was so helpful because I think, even with our parents and caregivers, it's also really important and helpful for students to know some of these areas, right? Because I always say the power is in the noticing. So when you start to notice those behavioral changes or those communication changes, it's really helpful to have this sort of model or guide, this traffic signal to let us know, like, okay, things are going pretty okay. Might need to be paying a little bit more attention. Okay, my child might need a little bit more support here. So I love this model, and I'm really thankful that you shared it. So I appreciate that. All right, so our next question. What current trends are you seeing with how students are socializing and forming or maintaining their peer relationships?
So, I would say the number one biggest trend, and I'm sure that many of you as parents who have attended our presentation tonight can agree and have seen this yourself, the presence of online friendships. That for kids, these are feeling just as real and just as important as in-person friendships. It could be, for some kids that there's a balance of in-person friendships that they have at school and other online friendships. And some, it's maybe more leaning towards they're not getting together as much in person, or maybe, they've started an online friendship with somebody who lives in a different state across the country, maybe in a different country. So I think one of the really cool things about this aspect of online friendships is that there's, I guess, a lot of different ways to stay in touch with people, let's say, even if you're not seeing them that often, and getting to know people from kind of different walks of life, different cultures, different parts of the country, even internationally. I would say with all of the strengths and the cool things about this trend, there are also some things as parents that we want to be aware of and kind of keeping our eyes on as well. As you guys know, kids can get, unfortunately, very creative with how they are bullying through social media. And I would say that is a trend that we're also noticing in a lot of the kids that we work with, that, it's not like how it used to be before social media, or things similar where a kid leaves school and maybe they're at home for the night and they're not near their bullies. Well, now social media, like, kids have access to each other pretty much 24/7. So whether it's like making a fake TikTok account to like bash another kid, or a lot of snaps being sent on Snapchat, that are really kind of cruel and intentionally meant to bully a kid. It's popping up in a lot of different ways. So just being mindful of that. I'm sure you guys are probably all very aware of that so far, and how that can really impact our kids' mental health, at the bottom line with that. As well, I would say a trend that we're seeing is friendships and even like romantic relationships becoming more territorial. And I would say social media is kind of facilitating that. So we have been hearing a lot of things like, okay, like if you're with me, even like you're my friend, you're my boyfriend, you're my girlfriend, you cannot be friends with these people. You have to have these people blocked on all of your social media. You can't snap them. You can't do this. So a lot of being territorial, I guess in that way, kind of within that is a trend that we're seeing. And also the idea that self-esteem and self-worth can so easily get tied up in how peers are reacting to one another through social media. So whether it's like how many likes you're getting on your post or how many views or other things, kids' self-esteem can really be impacted, I think, by that. And last thing I guess I wanted to share, with social media and online friendships becoming so more prevalent, there's a lot of information out there. There's a lot of information available about each other. There can be sharing of locations, other things. And so it can make it easier for kids to, let's say, feel left out if they can see all of their friends, on Life 360 or something like that, or at a particular house and they weren't invited. Or even facilitating, feelings of codependence in relationships too, like knowing if you're not with somebody, like what they're doing at all times, wanting to be with them. So I guess moral of the story, there are some really nice aspects about these trends, and then other things that, are concerning and ultimately can impact kids' mental health for the worse as well. So,
Yeah. Thank you for sharing that, because the internet, social media is such a dynamic space. And to your point, there's always the pros and the cons to everything. So just being mindful and having the knowledge of what y'all are seeing, as boots on the ground clinicians, it can be really helpful. So that, again, we can sort of keep an eye out for if we're starting to see any of those behavioral changes and, making any connections to, social media. So thank you. All right. So our next question: how can I support my child if they are turning to the internet and social media for mental health support and self-diagnosis?
Yeah, we're seeing that one a lot. I think to the point that we, sometimes as clinicians kind of joke with each other about, where did that diagnosis come from? But yeah, a lot of clients coming in, especially our young, clients saying, I think I have fill in the blank diagnosis. I saw a TikTok about it. I've had, on up through my adult clients sharing that. So it's not something that's only kids and teens, but it definitely is coming up a lot with them. So I think that if your child's expressing that or saying like, hey, I think this is true for me, I think the biggest thing will be to fight the urge to say, no, it's not, get off social media, enough. That really treating that as, well, here's an opportunity where my child is trying to say something to me. What can I take from this? Or how can I turn this into a moment of connection and like openness between me and my child, rather than I'm going to shut it down, close it down. Now, that does not mean that you are agreeing with the diagnosis. It means that you're approaching with that curiosity and you're kind of saying, well, tell me more. Like, where did this information come from? Maybe even saying like, hey, why don't we watch that together? Can you show me the TikTok that really speaks to you? Can you show me the website you're reading? Can you show me the, almost like a teacher saying like, show your work, your resources, right? And then I think we can all recall back to our school days of, primary sources and secondary sources. And, that this might even be a moment to really share with your child, like, okay, we watched this video together. Like, tell me about this person. Do you follow them on social media? Do you see a lot of their content? Is this someone that you just stumbled upon? Kind of what's their background, right? Is this a video of another teenager who's doing the whole like pointing at words over their head thing? Or is it, a professional who's really sharing, hey, here's some information that might be helpful for you to have. So encouraging them to consider the source. Is it a reputable source when it comes to any kind of mental health information or not? But again, like, how can you ask questions that will open up your child, your young person, to talk about that? So it's not just, oh, this is just another teen, knock it off. You guys all think you got something else this week, that you're really giving them that moment of like, okay, like, What do you think, like, where do you think they got that information from? Do you think it's that they're diagnosed with something and they want to help other people recognize it too? Can we go look for some other resources together? Can we go to the American Academy of Pediatricians website? Can we go to the American Psychological Association, the American Psychiatric Association? Can we go to some of those websites and really look at, diagnostic criteria and again, talk about this together? It could be a very educational conversation for you and for your young person. They could be onto something, they might be really connecting to something and saying, oh my gosh, I didn't know there was a word for this. I didn't know that there was, a way for me to express like, this is everything that I feel. So I think asking those questions, what makes this true to you? What part do you most connect with? What do you see of yourself in this? How do you feel watching this? Because again, we know kids, young people, they're really looking for a place. They're looking for connection. They're looking for a way to understand some really confusing things that are happening in their bodies with their emotions. I think there's a lot of moments where they wonder, am I okay? Am I normal? Whatever that means. So I think that it takes a lot of confidence to settle into yourself. And I think that a lot of us don't get that until we're, a little bit older, might still be working on it. So I think that the more you can approach it again with curiosity and give your child that platform to like talk about what they're experiencing, then you might arrive at a destination of like, hey, you know what? Sounds like there's some other stuff going on. We could go talk to your doctor about this. Would you like to speak to a therapist? Like, can I think on this? Can we talk about it again? I want to talk to your other parent about it. I want to go to my social supports as an adult, to my people and kind of say, I'm hearing this. I'm kind of wondering what might be going on. You don't have to finish the conversation right then and there with like, yep, stamped, diagnosed. It can be like, okay, like, can we keep an eye on this? Can we keep talking about this together? So that might be a really nice way to again, keep it open and keep the communication flowing without saying, yes, you have this thing. Yes, let's go get you medication tomorrow. There's no urgency and no rush. I think the biggest thing is to show your child, I'm listening, I'm listening to you and I want to understand what you're experiencing.
Ah, I love that so much. The takeaways that I heard from there really were, keeping that line of communication open, approaching with curiosity. And I'm going to borrow this from you from here on out. Show your work, right? Show those, show those sources. All of that is so helpful. So thank you. All right, so our next question, some children or youth turn to alcohol or other substances, so vaping, for instance, to cope with mental health distress. What are some helpful or healthy coping strategies that you can share?
Yeah, so keeping in mind, that every person is really going to differ on what might help them. What's really supportive for some kiddos, or not for others. When we have kids who come into the REACH program, one of the first things we do with them is a whole list of check boxes where we just go over like, hey, what helps you? What makes it worse? What feels supportive? What have you tried before? What are you open to trying? So I just wanted to, share a few general ideas, where again, there's many, many ways, to figure out what's going to be beneficial. Alicia talked a little bit about social media and some of the pros, some cons. There's some really great apps out there that a lot of the young people and adult clients that I work with are feeling really connected to. The Finch app is a really fun one. It's basically an app version of Tamagotchis for those of us who remember those back in the day, back in middle school. Or elementary school, possibly, keeping this little critter alive. So a Finch app is very similar. You're this little bird that the more you engage in self-care strategies, the more you journal, the more you put in the app, hey, I drank some water, I got a good night's sleep, I did a breathing exercise, the more that the little bird gets benefited, so it has this kind of like, oh, I'm taking care of something, much like taking care of a pet can be really therapeutic for people struggling with depression, for anxiety, for example. So Finch is one that I've heard a lot of really positive things about, that a lot of my clients have really enjoyed. Calm Harm and Clear Fear, they're made by the same company. And I actually recommend the Calm Harm app a lot to my clients, even if they're not struggling with self-harm. So it's initially geared towards people who are struggling with self-harm, need something to kind of help them get through any urge that they might be feeling. But I love, it offers so many different kinds of activities around, hey, I need a distraction, I need a soothing activity, I need, a loving, supportive activity, and you can randomize them. You can, it's everything from name as many Disney villains as you can to, find something soft, wrap up in it, journal about, a few things that happened today that made you smile. A number of different kinds of resources, squeeze something soft, like just really, really great ideas when people need like a distraction in the moment. And the Clear Fear app is pretty similar. It's a little bit more geared to anxiety. It doesn't have quite as many things listed as the Calm Harm. But those are some of the apps that, again, I've heard a lot of really great responses with. A lot of my clients have used them, found them really helpful in certain moments. Certainly seeking support, from the loved ones, identifying like, hey, who are your people? Who are the ones you go to first? Who are the ones that if it's starting to get a little bit more serious that you need to reach out to? Kind of, again, if you're in that green light section, okay, maybe I can just chat with my friends. Ooh, I'm getting into yellow. Maybe I need to go to my parents, my grandparents, my aunt, my uncle, my, whoever kind of their trusted people. And then if we're getting into the red, who are, again, even those more trusted adults, to my parents and let them know how I'm doing. And again, that approaching with curiosity, be open, ask questions, try not to shut anything down that your child's bringing to you. Help me understand rather than why. Why are you feeling this way? Help me understand what you're feeling. Why can't you just be happy? Help me understand what you're struggling with. So I think the more you can give that openness, the more the kiddo feels, okay, this is a skill I can use. I want to come back to you again. We talked about distraction, again, some of the apps, shows, books, music, art, different kind of exercises, grounding exercises, breathing exercises. Again, journaling, could be drawing for younger ones. Draw how you feel. Draw let's give the critter that you're angry at, let's give them a face, let's give them a color, let's give them a texture, and then let's rip up the paper together. That might be something, let's ball this paper up and I'm going to give you permission to throw it against the wall. That could be something that might really help your child in the moment when they like, I want to be destructive. And it's like, great, please don't rip up this. Like you can, crumple this paper over here. Certainly different activities, changing environment, changing that scenery can really change the mood. Again, not every kid wants to go for a walk, but maybe they're willing to sit outside. Maybe they're willing to sit by an open window. Sometimes you have to start really small with the expectations for them. Maybe it's just get out of bed, sit beside your bed. Sometimes that's kind of where we're starting at with trying to help kiddos, again, shift that environment. Again, physical movement can be really great for some of the kids. Sports, activities, exercise, going for a walk. It's not everyone's, cup of tea. Certainly doing an activity with someone else, again, like, hey, if you don't want to sit outside by yourself, is there anyone you'd want to go with? Any other kind of activity that they might want to do, again, with a friend or a loved one. So just again, some broad speaking coping skills that might be beneficial, but I would definitely check out the apps because they can be pretty helpful.
All right, thank you so much. So we do have one final panel question before we get to our audience Q&A. And so our last question is, I want to be supportive of my child and allow them to have mental health days if they need them. But how can I support while also encouraging school attendance and navigating school refusal?
This is definitely a tricky one, and I would say it's one that we try to support parents in a lot through our work with Reach. So I think another helpful way to consider the answer to this is to look through this kind of stoplight metaphor again. So if there are circumstances, let's say your kid is totally spent from like Keystones testing, they're exhausted, or PSSA testing, they're exhausted. And they're asking for some type of mental health day, and it's sort of like a one-off thing. That to me would seem to be more in the green zone because the emotions that they're feeling, maybe it's like very drained, exhausted, just like really feeling so much, like it would be very hard to work up to standard, at school the next day. That seems in the green zone to me. It's related to an event. And it can be really nice to kind of listen to them asking for that. They're trying to honor their own feelings, how their body's feeling, what they're noticing about what's going on in their mind. So if it's kind of few and far between, it can be great to allow a mental health day. When it would go, more into the yellow or more into the red is, let's say the mental health day isn't necessarily, in response to something that's happened, or it's not few and far between. Maybe the frequency is increasing. Maybe you're getting more pushback about going. Maybe there are things that are causing school refusal more so than just like your everyday stresses or needing a break. Maybe there's an underlying mental health concern or something more broader that's going on. So again, I would say, it can be great as well for parents to model taking a mental health day too, if you can, if you're in the situation that you can, that it's okay to listen to what your mind and body are telling you and to take some time to rest, because rest can be productive too. However, if it's more of the resting that it's turning into a pattern of avoidance of school, that's when it could be a good time to seek more professional help, kind of in the ways that we had started talking about before in this stoplight metaphor. So,
Yeah, and if one day off doesn't seem to, again, offer any kind of a relief, that could be the sign of, okay, we're getting more into the yellow, we're getting more into the red. One day is not enough for my child to recover. It's almost like they need the whole week in order to kind of get their emotions in a better place, get their mind in a better place. That's an excessive amount of school to be missing. That's where teachers get really worried. There's a lot of content that's being missed. So I think that, yeah, if you're seeing like, again, this isn't just stress and I need a day and now I feel a lot better. If you're seeing like, wow, this is kind of, again, overall functionally, my child is having a really hard time, that's when that short-term avoidance of school, again, feels really good for the moment for that kiddo. But in the long term, it's just something is hard, I need to run away, and that's not the skill that we want them to use as their main coping skill all the time.
All right. So thank you both so much for the presentation that you provided about anxiety and depression, as well as answering the panel questions. All of this information was so helpful. So thank you so much for joining us.